tuned in to The Andrew Lawton Show.
So the capital gains tax increase is not, as the government presents it, going to be a panacea. And more importantly, and I think this is the crucial point here, it isn't just the super wealthy that's being affected. It isn't just the super rich. They want to say that this is just a billionaire tax. But the reality is there are a lot of Canadians that are going to be affected by this capital gains tax increase that do not fall at all into that category of the super rich, that don't fall into the category of the super wealthy, that certainly aren't living in gated communities or flying on private jets or getting private healthcare necessarily. And a lot of these people are ordinary small business owners, because remember, it's people that own and operate small businesses who are not given any carve out or any exemption whatsoever from this. So yeah, the super wealthy are going to be hit by it, but also small business owners. And in particular, we've seen from the medical community in Canada, doctors who look at their professional corporations as being a vehicle to save for retirement are being especially penalized for this. I want to welcome into the show Dr. Kathleen Ross, who is the president of the Canadian Medical Association. Dr. Ross, good to speak with you. Thanks for coming on today.
Oh, thank you very much for having me.
So let's just begin with the mechanics of this. Why are physicians affected by this in a way that many other groups in Canada are not?
So it's important for Canadians and policymakers to understand that medical corporations are not like other conventional corporations. And that is how many family physicians and other community-based physicians operate. We don't incorporate to build a big practice so that we can sell it. But we do use our corporations to keep money for retirement and other major life events like maternity care, parental leave, or sick leave. Honestly, with the current nationwide shortage of physicians, particularly those delivering the kind of primary care community access that we need, this is a challenge. You're never going to be able to sell your shares or make money off of a corporation.
Yeah, I think that's an important point. And I would also add here that, yes, doctors are paid well for the work that they do. And I don't want to say that doctors are dealing with, the economic hardships in a way that other people are. But I think it's easy to overstate how wealthy the average family physician is, or especially, rural physicians. And people often forget how much overhead they have as well to run their practices, both in terms of they're dealing with the effects of inflation as well. And medical products that they have to put in their offices are expensive. So these people do not fit into this category of the super wealthy, but the government's messaging on this tax increase has been that it's basically just billionaires who are affected.
Yeah, and I think that's just one piece of the misinformation that's come out with the announcements over the last several weeks. There are roughly 75,000 doctors practicing in Canada, and half of those operate as professional medical corporations. So the estimated 40,000 people impacted can't just be the doctors that she's talking about. So I think we do have to take a step back and really understand this. As you mentioned, self-employed physicians are responsible for those critical infrastructure pieces. So to provide the community office that patients are seen in. We cover those overhead costs, like rent and staff and salaries and all the medical supplies and office equipment. And at the moment, that amounts to anywhere between 40 and 45% of our gross clinical revenue. And the funding and provision of that critical infrastructure is really not easily replaced.
I'm assuming that when this was announced, you were trying to engage your partners in the federal government on this. And I mean, obviously, from what we've heard, there has not been a carve out for doctors. But did it seem like they were receptive to this concern, at least at any stage in the process?
So we've been presenting the information that that federal government asked about, and they asked some questions after the fact. And we've presented our information, I think, in a fair and balanced way, particularly as this is being marketed as a tax fairness. Is this actually fair to professionally incorporated physicians? And the answer to that is no, because unfortunately, this will mean maximum capital gains inclusion rate on the very first dollar that earns capital gains inside of a professional corporation. There's no carve out at all. That $250,000 that applies to individuals, or the $1.25 million that applies to other small businesses or corporations, does not in any way apply to medical professional corporations. So the other piece that's really important, because it was mentioned in today's announcement, is that we do not have the ability to simply increase our fees to make up for tax increases or inflation as it relates to overhead, and other professionals may well be able to pass those costs along. And the thought that we could just simply go and adjust our provincial agreements to make up for this change at a federal level is really misinformed. So we do need to have these conversations. We want to continue to have these conversations and really explain to the finance ministry how it is that the healthcare system operates, and what role professional medical corporations have in delivery of critical healthcare services to Canadians.
And I should also point out, I mean, this isn't doctors exploiting a loophole. Over the years, governments have actively encouraged them to structure their businesses in this way in lieu of fee increases, have they not?
Absolutely, and I think it's really important to reiterate. And I know I've said it before, but physicians train for a long time, more than a decade. We don't
Mhm.
start our careers till we're well into our 30s, most often. Our rates are actually fixed for what we can earn to pay off our debt, and most graduate with an average debt of $300,000. That's a substantial setback, and our careers are shortened because of how long it takes to get where we're going. So these are critical pieces to consider. We have to save for our retirement. I mean, Canada does have a great deal of social programs to support retirees, but we are highly trained professionals, and saving for our own retirement makes sense where it may not make sense to other pockets of workers in Canada. But I think we do need to consider all of these things as we look at shifting how we pay doctors and how we save for our retirement.
So we know that there isn't going to be a carve out. We know the announcement is forging ahead. And we know that, as you indicated there, doctors cannot just raise their fees to deal with this. So realistically, what is going to come from this? What's going to be the effect now that the genie is out of the bottle, if you will?
So I think there is still space. There are ways that we could recognize professional corporations and allow them to have the $250,000 personal exemption that's afforded to individuals, because our medical corporations are, in fact, us as individuals. The other piece would be to look at including medical corporations in the 1.25 million lifetime exemption. And again, these are possibilities. And I think although the bill has been proposed, there's still space for us to have this conversation. And we want to make sure that we're sharing the right information so that the government can make appropriate decisions, and not risk destabilizing the critical parts of our healthcare system that we need. We need physicians setting up in community practice, carrying that infrastructure and providing services to Canadians. And we're already a little bit beleaguered and worn down, and carrying the burden of a healthcare system that in many ways is crumbling around us. We don't need another reason to discourage physicians from setting up the practices and delivering the services that Canadians need.
So do I take from that you remain, at least in some way, optimistic that there is still a way to deal with this?
The door is still open. I think there's still time to have a conversation about the uniqueness of medical professional corporations, and we want to have those discussions.
All right. Well, Dr. Kathleen Ross from the Canadian Medical Association, thank you so much for your time.
Much appreciated. Take care.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.